Hi there, I'm Doreen. This is Vitals and Verdicts. I'm here with Brandy Seyller, the founder and creator of the Clinician Expert New Soon to Be Community. Welcome. Nice to meet you, Brandy.
Nice to meet you. I appreciate it. Thank you for having me on. This will be exciting.
Yes, I'm excited to have you. And I love your accent. Tell us where you're from.
I'm from the South, Georgia. I currently live in Charleston, South Carolina. So I feel like I don't have an accent, but we'll leave that subjectively up to everyone else.
Really? Well, compared to my Boston accent, I'm sure. Tell me a little bit about how you got involved in legal nursing at all.
So I've heard about it way back in the day. I kind of bought a book, looked over it, didn't think it was for me. I thought it would be a 9 to 5 job. I enjoyed being at the bedside. I still enjoy being at the bedside, but eventually one of my cardiothoracic nurse peers said, "Oh, you're an expert. Why don't you look at this case? I have a friend that's looking for an expert." Took a look at the case, loved it. It was not as it presented. You really had to know what you were looking at and be active in the field to really find what I found. And it absolved the all four nurses named from responsibility of what they were accused of.
Well,
And there was actually an underlying issue that happened in the OR. And so from that point on, it was very exciting. I still thought you had to be asked to do it, basically. And then I didn't really understand that it could intercept with legal nurse consulting either at that time. So I still continued at the bedside, and as people would call me for cases, I would do that until it became intentional.
nice. And your clinical nursing background, it's all OR?
Oh, no OR at all.
No.
Just
Mhm.
popping in there when we have some cases I have to go in for, as far as ECMO is related. But
Okay.
background's critical care, pediatric cardiothoracic surgery. I'm not an expert in that though. It's been years. And then adult cardiothoracic surgery. And I'm an ECMO specialist. Started doing that in 2006, back when they had the roller head pumps. And went through the transition of various different types of equipment to really, that's what I call life support, to, oxygenate and circulate the blood.
Fascinating. What expertise do you think you relate with the most as far as accepting cases?
So, I'll be asked, even if I'm up front, I might get a med surge case come in, and I'm like, if you're just looking for me to review it and give you some pointers, I can do that. But I am not a med surge nurse, and they will insist sometimes. So I'll look through a case, and sometimes they'll even resolve the case without even needing an actual expert. As long as you're upfront with the attorney, works well. But I love critical care cases, um, definitely ECMO cases, mechanical support devices. And, I've been kind of cornered into falls and wounds. Which I
Not
keep
your favorite?
yeah, I keep reminding one specific attorney, I'm like, "I am a critical care nurse." He's like, "Yeah, but you're really good with these cases." So
Send the fall cases my way. I did geriatric psych for years, and we'd had
oh,
a fall
okay.
every week, so that's definitely my
Yes.
jam.
Okay. Good to know, good to know.
And so tell me what gap you saw that you decided to make this community or this website. What were you
Yeah,
looking
that's a good
to?
question because that's really it didn't come unintentionally. It definitely was difficult. I started being asked to provide, do I know of any experts? And of course, working in the field, I knew of a lot of people, asked them if they would be experts. It came a lot easier back then. But I started reaching out to people kind of voluntarily without actually having a case, saying, "Hey, I've got, a personal database. Here's the link if you want to upload all your stuff. I'll, call you." And I definitely have made a lot of referrals just that way. But when they needed an expert and I didn't have somebody, I didn't like that pressure. I felt like maybe who we chose was not going to be the best match necessarily, just because of being under that pressure. I just didn't like that part. So and I started to discover some of the experts that were chosen were maybe they didn't have that little niche that would have made them even more impactful on a case. And, referrals are great, but there's also a little bit of referral bias that can happen too, where you might think somebody's really a great fit for the case, and that leaves an opportunity for the attorney to just assume that they're going to be great in all these certain areas and not vet them themselves. I saw some of that. The static directories, I mean, you don't even know when their last experiences are updated. Of course, there's some attorneys. I mean, I have attorneys that are like, I'm good. I'll just flip open the directory and find somebody, and they're good with that. Creatures of habit. That's what they're going to do. It's going to be hard sometimes. I believe it might be hard to change over what people are doing to kind of use a more advanced technology platform. But I think it really offers the best potential match up front that you can have without having that delay of multiple emails, multiple setup times for phone calls, never hearing back. The listservs, I've given many referrals through the listservs, not just for me, but like for others, and then never hear back. Never, oh, thank you for that, or we found somebody else, and then it just became frustrating to where I'm just going to start my own expert witness platform. There's links in there where you can have basically a credibility score. It's called a cheer score. It goes over 5 factors that attorneys find really important, but yet they don't know unless they've been rated. Attorneys can set preferences as far as what they're looking for. They can have hard stops. They can pick 3 of those, and then they can kind of weight what their preferences are as far as communication, timeline availability, likableness, testifying, trial experience, and they pick a weighted score. And then when they search, it'll come up with like 3 best matches and actually give a best match score for their preferences. And then, I feel like that optimizes the search up front.
And you kind of touched on it, but from an attorney's standpoint, what does make an expert witness stand out?
And it's different. It's different for what the attorneys are looking for individually. You might have a high profile athlete that, had orthopedic surgery, and, you're not just going to call the guy working over at, Roper Hospital necessarily. You want to find somebody that's top of their field. That requires searching a niche area. Whether or not an expert has experience or not is also sometimes preferable or not preferable. It just depends
Yeah.
on the attorney. What makes a strong expert is, number one, you have to have the experience. At least 5 years experience is pretty standard, because I mean, any of us know you can be pretty competent at a year, but you're not an expert. You're just not.
Oh, clinical experience, correct?
Clinical experience,
Yeah.
absolutely. And then my site is for clinical experts, so that's really all I speak to in relation to expert quality. Being published is good. Being guarded on social media. You don't want to put all your opinions out there and then it be used against you. Having clean licensing record, definitely. Being able to communicate clearly. And then the last part, which you're not going to know until somebody starts having deposition and testifying experience, is testimony skills. And that's where on my platform, I'm developing a course not only for testimony skills, but building practice and the business side of things as well, but understanding the basics. Because an attorney will prep you, but they don't oftentimes give you prep on the areas where you can create danger for the case, like speaking to causation. When I had my first testimony experience, I didn't know about causation. We can speak to it clinically. We are expected to know the underlying, clinical conditions that are leading to a potential poor outcome. That's how we operate well within our field as nurses, right? So I was used to that, very strong clinically. And I came into a case and, spoke to causation because they asked me if a neurosurgeon, you want to hear this? I feel
Yeah.
like okay. He said, so if the neurosurgeon in charge of the patient's care said that he thought the reason the patient went into respiratory arrest was because of a mucus plug, would you agree with his opinion? And I said, no. And he started yelling at me, face red, like slamming his hands down on the desk, like, you mean to tell me a Harvard trained neurosurgeon, you wouldn't default to his opinion? And I was waiting for an objection or something, he was like, I said, no. And he was like, what's your rationale? And I was like, because on page 3000, whatever, because I knew the page number. And also, I waited a minute. I didn't just answer. I gave myself a minute, and then I remembered, oh, yeah, his progress note said specifically respiratory arrest leading to cardiac arrest, etiology unknown. And so that
Mm.
I said, because in his own notes, he said he didn't know the etiology at the time that that happened. But I feel like the attorney probably asked a poor question. Now, if he were to say, and if the expert witness said he thought it was a mucus plug, I couldn't speak to that. Do you see what I'm
Yeah.
saying?
Yeah,
I
I
can't
do.
speak to their opinion. So, you can really cause the loss of a case, even though your opinion supported, that there was some bit of negligence for a poor outcome in that type of situation. I could have been, stricken my testimony or been impeached. Yeah. And there's other risks as well. The American Medical Association considers expert witnessing practicing medicine for physicians. So if you're not speaking ethically and considering all the data objectively, rather
Mhm.
than listening to what the attorney told you and being biased reviewing the medical records or not reviewing all the medical records, you could actually be suspended from your professional organization or go in front
Yeah.
of your licensing board. So, I mean, it's a real risk. People should be intimidated when they go in initially.
Well, don't take it lightly, for sure.
Correct.
And now I just have to ask, when you're able to, throw out the page number and have that information, what was the attorney's response?
He was in shock, and then he said no further questions. Funny is, in between, we'd have these questions about living in Charleston, la la la, and then we'd get back on the record, and he would just like grill me, right? But
Mm.
his only goal was to get me to admit that my input had no relevance, basically, right? By saying I would default to the medical doctor. I don't know. I'm not an attorney, but I think he asked the wrong question on that one.
Well,
So,
sounds like you did a good job, so there you go.
yeah.
Love
Yeah, they
that.
hired me again. So
What do you think are some common mistakes that the attorneys do make when they hire expert witnesses?
maybe not knowing the chart well enough to ask the specific questions to see whether or not an expert is qualified to speak in that niche area.
Mm.
I mean, and this is why I'm talking about referral bias. I was referred to an attorney for a case. And so we both kind of assumed I was qualified for it. And I read the case and it was a PACU case. And I was like, I have no idea. I mean, this seems wrong, but I can't speak to this. And so we had to find somebody else for the case. But so I think finding the right qualified expert. um I think the challenges are the emails back and forth. Sometimes that can delay. Also, waiting too late to find an expert. And I think that's where clinicalexperts.com will come in handy, is because, attorneys can just post a case too. They could just post a case and the experts can reply if they feel like they're qualified, and then it'll come up with the best match score depending on their preferences too, because they put it on a posted case as well. Not having access to really highly qualified experts. Maybe they're having to go through their different programs that they have where they can go and research experts that have testified before. That might be a really good way to find an expert potentially, but it takes a lot of time. And
Yeah.
time researching for an expert is time and money lost putting toward planning for the strategy of a case, right? So that's how
Yeah.
that's how I look at it. Those are pretty much the top. And not having a feedback loop, not knowing how, without having access to some of these programs through like LexisNexis, Thomas Reuters, Walters Kluwer. I mean, these are the top companies that are very expensive, but where a lot of attorneys manage your cases. And you could get access, to this. It's just not having a feedback loop of how professionals have performed, because, getting the deposition transcripts, they're not always just publicized where they're accessible. I
Yeah.
think I've seen where they've had like listservs where maybe they share them. I don't really know. That's kind of what I've seen on the side. And I was like, oh, really? It's just not on the record somewhere? I could be wrong on that, but I just thought it was just public information or something. But, these agencies have licensure over a lot of this information. And it's expensive to get access to it.
Yeah. And like you said, things get expensive and all that.
Yeah.
Mentioned it a little bit, but tell me your knowledge or experience in mistakes that new expert witnesses can make with marketing and social media and online
Right.
presence, all that stuff.
Well, somebody has been making posts pretty consistently. I was in denial that people would do this, right? I saw people making posts about it, but they're posting about cases they're actively working on.
Mhm.
That's not a good idea because whatever you're posting about it can be used against you. And I'll tell you, here's a little secret of marketing. I posted the 7 traps that opposing attorneys can use against expert witnesses.
Mhm.
And then I made it to where they had to go put their email address in to download it. And it gave you and I'm going to put it up again because I feel like it was useful resources and I've been told that it was.
Yeah.
And it gave examples of questions that they might ask, and then how one might respond, and then how you might want to think about responding. I'm not saying that's how to respond, but just ways to get you thinking differently. Because the process of being deposed or giving your opinion the way that your question, it's just not normal interactions. It's just not the normal way that we communicate. So, and it can be very triggering as well, too. So
Mm.
you have to learn how to deal with that. So part of that is um, not not posting things that can be used against you. Relying on the attorney to feel like they've been prepped adequately. That's a lot of what I went through. I was just like leaving it in the attorney's hands. Like, I don't know what I'm doing. Oh, you'll be fine. You'll be fine. We'll prep. And I think the first time maybe we met like a week or two before, because I was new. And then I felt like I needed like another prep session. So I had it again. I was like, okay, he says I'm prepped. But see, they don't know what you don't know. And so
Yeah.
that's another reason I developed this course is because you're not going to know what you don't know. And sometimes you can get into a situation, you might even overstudy and you don't want to be over prepared on the actual information on what to say specific to the case. And I think that's probably why attorneys, you know, kind of stay away from really specific prep. But, you need to understand the process of how to best answer a question. Like, hypothetically, if this happens, you need to know how to answer that. Do you just answer the question? Do you say, I'm not going to answer hypothetical? Do you say, well, hypothetically, this can happen, but in this case, the facts were at that time, and I think it's important to know some people can naturally do it. I feel like I had a natural affinity to understand that, but I also felt a little insecure at first because I didn't know if that was the right way at the moment I was doing it because I wasn't prepared for that.
Yeah. Yeah. Nursing and legal are quite different worlds. So trying to piece them together can be complicated for sure.
Yeah. Yeah. Because clinically, we're expected to know and respond in one way, and then legally it's another. And it's okay, for the attorneys to tell you what their objectives are as far as how they're approaching a case, because you might have 10 points that you find 100% relevant to the outcome. But the attorney's plan is maybe those 10 points aren't as valid because it might water down the whole situation. Let's just focus on these 3 points, you know?
Mm.
Let's make
Mhm.
sure I understand what your opinion is on these 3 points. And then that's what we're going to focus on, 'Cause it can be overwhelming sometimes, especially in nursing. I feel like, in nursing, we have all the nuances of our documentation. We don't just have a progress note. We have what we charted, when we charted, how often we charted. Did we chart a follow up? Did we chart notifying somebody? I mean, we are in that chart. I measured one time 4 hours a day. I was like, I don't know what they're talking about. We're in the chart 10% of our time. 4 hours is not, with all these patients, is not 10%, So,
I know.
um,
It's wild. Flow sheets and notes and secure chats and oh yeah, those are
yeah.
all the
And,
things.
and I'm like, I'm old now because back in my day, right, we had like a fan fold flow sheet. We just put turned, check to the left. Like that was it. That's all we had to do. It took 15 minutes to chart. So whenever the systems go down, I'm like, I'm getting that paper chart out. Everybody's like, oh my God, what do I do? You just put a check mark.
You literally just write.
Literally
Yeah.
just like put a dot where the IV is and put right AC. That's all.
Yep.
Paper,
I know.
check, you know.
Even I started on paper, so yep.
Yep.
Absolutely. Oh, actually, I mean, tell me, how does technology change the expert witness world? There's definitely a lot changing nowadays.
There is. So I also started expert witness work when we had a huge, I don't even know what they called it. It was like a hardbound book, basically, of 4,000 pages, heavy, right? Probably
Mhm.
15 pounds. And I loved it because it was in chronological order. It told the story. It was
Good.
beautiful. You could just put little, sticky notes on the pages or whatever. But now with technology, it doesn't flow like that at all. What you see in the chart makes sense if you're in, Epic or Cerner or Meditech, well, Meditech doesn't make sense. Let's admit that now. But, you know, it makes
I'm a big
sense.
British fan, I gotta tell you. I'm probably the only one.
Ugh, ugh, ugh. You got to know your F keys in that one. But,
Mm,
but anyway, it might like literally flows right to left in one program or lower to upper. So you're scrolling up, not down. And so it can throw you off. It makes you less efficient, all that kind of stuff. I don't think necessarily AI platforms can extract the data sometimes the way that it's formatted consistently yet. Actually, I did build something that does that, and I put some data in it, and it spit out like a table of turns, and I was like, "Oh, I might have built something pretty cool here." Anyway, I don't know how it happened, but I think extracting the data takes time. I used to like extracting the data and like writing my own chronology. I feel like as an expert, when I have to testify to something, that's how I knew that page number. So I wrote
mm,
it down. I'm thinking about it. I'm reading it. I'm writing it. We have to be careful also about how we form our opinions because if we are asked what did you use to come to your opinions, and you might cite some articles and all that. Did you use any AI? Did you use any AI platforms? Well, then that is discoverable, right?
mm.
So if you're using, um, Claude or ChatGPT or one of these platforms and they retain this data and you're asking about, you know, tell me what you think about this and it comes up with a clinical opinion, then your clinical opinion can be challenged. Like, this is not your opinion. This
Yeah.
is opinion that you formulated using AI.
Yeah,
So
yeah.
staying away from that stuff until we understand that we're not compromising the value of, as long as it's, um, HIPAA compliant and all that. But see, I like a lot of the process of extracting the data. I feel like it helps me remember better.
Mm.
So yeah, just being careful about developing the clinical opinion.
And you touched on how triggering or upsetting going to court and all that stuff could be. What would your recommendations be for the newer folks on how to stay resilient through all this and enjoy the work?
Absolutely. So, it is like you are doing a marathon the next day. I mean, if you're sitting there being deposed or questioned hours at a time, or you're sitting having to wait to be questioned, you know,
Yeah.
get good sleep, make sure you're hydrated, make sure you're well fed, bring snacks, take breaks if you need to. And when you start to get questioned, because it will happen, I mean, you'll be dead set on your opinion, and you never know when it might occur. But being prepared to be triggered, I mean, like feel anxious or feel that adrenaline rush come up, and identifying it in your body and recognizing what to do to bring you centered. Because a question like, you know, um, tell me your opinion about this. And then you tell your opinion, you'd be like, wait, are you sure? You mean to tell me? You know, kind of thing could be like, oh, wait a second, can make you doubt yourself. So that's why it's important. You need to know that chart back and forward. You need to be understanding every aspect of your opinion. You have to know the data. You have to be confident. You got to speak confidently. You got to know how to respond because naturally if you're a healthy communicator and somebody's questioning if you're right on something, it's best practice in communication to consider, am I considering all angles? Am I being fair about this? So like I said, it goes against natural communication sometimes.
What advice would you give to people that want to step into this world but kind of don't know where to start, if they're suited for it or any of that? Would you have any advice on how to ease into it, I guess?
Yeah. I would say make yourself available. Make yourself available to speak with somebody that does it. I would maybe reach out to an attorney. You can stop by an office, you can make a call, you can go to a conference. and really connect with an attorney that you can ask, like, hey, I want to do this, but I'm a little scared. Can you give me some advice on this? You can take a course, you can go, there's plenty of courses available where you can buy a book or go to a conference, get a lot of information. But what's going to happen is you're going to get all this information and it's overwhelming. You don't know what's important, and that can cause you to feel like you're not unprepared as well. Um, and that's another thing I'm building into this course too is like a practice feedback loop on being under pressure, asking. I want somebody to ask me questions under pressure where I can't wiggle out of it to see how I might respond, you know? Uh,
Absolutely. Yeah.
yeah, and just know the basics, take a basics course. You don't have to, but I find that you're more effective if you do. I mean, your goal is not to win or lose a case, but you don't want to lose a case because you didn't know basic rules. Um,
Yeah, do you wanna speak a little bit to that of, what the hard lines are there of where you can get impeached for?
yeah, so definitely speaking outside of your own clinical role, and then not being consistent from what you said in deposition versus what you say at trial, not being consistent with any published data that you've written. So, if you did a study that came about to find one thing and that changed your practice, but yet you're testifying against what you've written, and
Mhm.
definitely if you're publishing something on social media about like a belief or something that contradicts what you're saying in your testimony, I think that's the main thing is just being consistent and then studying your deposition before trial, because
Mhm.
you've got to know that. So not only do you need to know the chart and the medical record, I mean, there's years in between this. There's spans of years. Like
Yeah.
I mean, it doesn't matter how thorough you read the records. If a year and a half's gone by, you're going to have to go back and read the record again. Oh, and I mean, you can Google it or go to perplexity.ai and ask for research. I mean, keeping up with your certifications, make sure your CV matches everything. You don't want to put that you have a certification that you don't have. Keeping up with your license, all the basic stuff. Don't try to, you know, appear overqualified if you're not.
Yep.
And being
Stay in your
honest,
lane.
yeah, and being honest in your clinical practice too. Like if they say, what percentage of time are you in the cardiovascular or thoracic ICU? And you say all the time, but really they can go pull your schedule and see
Mm.
that you were in med surge. Any way to be inconsistent is going to be a disadvantage.
What kind of impact do you want your community or your, clinician expert site to have as a whole?
And, so I'm going to say a belief because I'm going to hold myself to it if I'm ever deposed about this.
Yeah.
I believe we all have the ethical responsibility to be able to speak to the standards of care of our peers, right? And so that's the basis of my community. So I want to provide access for people to be able to do this role because that's what I believe. I believe we should all have the opportunity to be in this role as an expert, speak to the care that we give, to the
Mhm.
standard of care of our peers, definitely. And so with the site, I hope to open up access, hope to educate, and hope to provide attorneys with access to these people that are vetted, good quality experts that are just at the touch of a button.
Yeah. Excellent. And if folks are interested in joining the website or, partaking in any way, how can they find you? How can they join?
Well, I'm on LinkedIn under Nurse Brandy Seyller. And then also my website is www.clinicianexperts.com. And there is a free basic account.
Mm.
It's private, anonymous. You're not out there Googleable, like, oh, you're on clinicianexperts.com. I mean, surely they can ask you, are you advertising anywhere? And you could say, well, I'm part of this community. But yeah, I would say join there, start. The course should be up soon. And I'm offering 10 students access to this course for something very minimal, just enough to have the course on iCloud or whatever. But
Yeah.
and then give a review and see if it's effective. Because if it's not, I don't want to do it.
Yep. That's
You
fair.
know, that would be embarrassing. So if there's anybody that's interested in taking this
Then
course and giving me
hide
some
your head.
feedback, that would be no. So anyway, yeah, find me on there, and if anybody just wants to connect and talk about it, I definitely enjoy that too. Encouraging the community. You might not need anything that I have to offer, but definitely willing to guide you in the right direction. And the one piece of advice I can definitely say is you got to network and ask for referrals. I mean, you don't have to ask for referrals if you're good enough, but sometimes the attorney is you're not top of mind all the time, you know?
Mm,
Um, and and then they'll be like, "Oh yeah, I'll refer you," so sometimes you just have to ask too.
yeah, absolutely. Can never hurt to ask, right? Well, I mean, I don't have any other questions for you. Any other last thoughts you can think to throw in?
No, I think you're doing a great job. I've definitely seen you, in the community and making connections. So I can't see where I
Thank
can't wait
you.
to see where you're going.
Oh, thank you. And it was so nice to meet you.
Nice to meet you. I appreciate it, Doreen.
And I'm sure we'll be talking again.
Yes, absolutely.
All right. Well, you take care.
All right, bye.